Fat grafting, the benefits in orthognathic surgery or jaw surgery. When we're doing jaw surgery, we're repositioning the bones, and we're doing this in a way to optimize the facial balance and support. And frequently, if the skin is not well supported, repositioning the bones will support it in tightened areas of the skin where it needs it. But in concert to this, we want to think about the soft tissue and how the soft tissue drapes. And if we're moving bones in some way, shape, or form, sometimes there can be some soft tissue imbalances as well. Sometimes based on how we're moving the bone, there can be a bony irregularity as well. And we can use fat grafting to help augment these areas that may be poorly supported or not balanced. We can use it as well where the bone may have otherwise created a little bit of a depression or a notch. And it's very valuable to use in concert with orthognathic surgery. We've also written and studied this and written a few papers on how it really can help and optimize the healing potential. So we're not sure exactly why, but because presumably the adipose-derived stem cells and many of the natural cellular elements, parasites and adipose cells included within the fat grafting that we're doing, placed on certain areas, this helps prevent bruising and swelling. And when we followed patients out in terms of their edema or their swelling post-operatively, those that had fat grafting concurrent with orthognathic surgery resumed to their normal or had resolution of their edema in a much quicker fashion than those that did not have fat grafting. So in addition to the healing and the augmentative and the aesthetic benefits of fat grafting, there's also some evidence that it's going to help with recovery, diminishing bruising, and allowing a quicker restitution to your baseline swelling, getting rid of your swelling quicker. Fat grafting also is really helpful concurrently with facial bone implants. When we place facial bone implants, this certainly augments the facial skeleton and can redrape or push out the tissue that's overlying this. Sometimes it can actually thin that tissue a little bit because when you're creating pressure deep to some of the facial tissues, that can actually thin with time. Depending on the type of implant we place as well, sometimes there can be a capsule that forms around it. So I think fat grafting is a critical adjunct that we do at the same time to help mitigate some of the thinning of the tissue, as well as where the facial implants are. There can be a little seam, or there can be an interdigitation of the bone with the implant, and we want to blend all those areas so that you can't feel or palpate or see a step off of where that facial bone implant is. So we often will advocate for doing fat grafting concurrently with facial bone implants. So thanks for listening. If you have any other questions, please check us out on our website, www.dereksteinbacher.com. Thanks again.